Dear colleagues, dear Director General Mrs. Burke, many thanks for having me today at your conference on environment and health. I would like to tell you about how the European Commission is acting to strengthen the understanding between environmental degradation and health impacts and design more integrated policies, enhancing the well-being of our natural ecosystems and of our citizens at the same time. Nature plays a crucial role in providing food, medicines, and a variety of materials which are fundamental for our livelihood and well-being. But the degradation of our ecosystems, including from deforestation, competition for the use of land, uncontrolled expansion of, in particular, intensive farming, infrastructure development, and the unsustainable exploitation of wild species have created a perfect storm for the spillover of diseases from wildlife to people. The recent lockdowns due to the COVID-19 pandemic have shown us the value of green urban spaces for our physical and mental well-being. More importantly, the COVID-19 pandemic has clearly shown that climate change, biodiversity loss, and human health are interdependent. All of these emergencies are a result of our broken relationship with nature. So there is an absolute necessity for an integrated approach to health and environment. And this is exactly what European Green Deal is about, as it places top priorities: the fight against climate change, against biodiversity loss, and against pollution. So let me now focus on the Zero Pollution Action Plan for air, water, and soil, which the College of European Commissioners adopted in May this year. Jointly with the Chemical Strategy for Sustainability adopted in October 2020, this action plan translates into action the EU's zero pollution ambition for a toxic-free environment. The zero pollution ambition goes hand in hand with all the Green Deal objectives because they are mutually reinforcing and complementary. This is particularly true for our climate ambition because in most cases, reducing CO2 emission means reducing air pollution and very often noise too. And this in turn can bring about very significant health benefits. Despite tangible progress, according to the Lancet Commission, in 2015, pollution still led to an estimated 9 million premature deaths worldwide. This represents 16% of all deaths recorded worldwide. This amount still represents 3 times more deaths than those caused by AIDS, TBC, and malaria combined, and 15 times more than those due to all wars and other forms of violence. According to estimates of the World Health Organization, 1 in 8 deaths in Europe is linked to environmental pollution. And about 90% of these deaths are due to chronic diseases, out of which cancers are among the most frequent ones. Furthermore, pollution comparatively affects more the most vulnerable ones: children, people with medical conditions, older persons, and persons with disabilities, and those living in poorer socioeconomic conditions. Energy poverty and air pollution are intimately linked. Economic inequality breeds health inequality, and vice versa. These huge differences and inequalities exist in Europe as well. Pollution is associated with 27% of death in Romania, while it accounts for only, although the figure is still too high as well, 10% in Denmark and in Sweden. Furthermore, pollution is one of the 5 main drivers of biodiversity loss, threatening today the survival of more than 1 million of the planet's estimated 8 million plant and animal species. Its negative impacts are expected to worsen until 2050 and beyond, unless we manage to change the course of action drastically. In conclusion, there is an urgency to act on pollution, and especially to do so at European level. So, in the face of this huge moral obligation to change, we have a good news. Today, we have an unprecedented opportunity to act better and faster. The recovery plan for Europe provides us with a total of 1.8 trillion euros that we can use to build back more fairly, sustainably, and cleaner towards our zero pollution ambition. Let's be clear, this zero pollution ambition is not an utopian absolute zero, which actually would be irreconcilable with life on Earth. It is an objective to secure that by 2050, pollution is reduced to levels which are no longer expected to be harmful for health and natural ecosystems, which respect the boundaries of our planet, thus creating a toxic-free environment. The zero pollution ambition also makes business sense. As the EU countries are working hard to develop their recovery plans and actions, we are urging them to seize this opportunity to fight pollution, embracing innovation across the board and reaping the benefits. Green technologies can help us reduce pollution and offer business opportunities. Just think of better pollution monitoring system, new decontamination techniques, and state-of-the-art solutions to remove microplastics from water. So what you see now in the slide is the 9 flagship initiatives which are spelled out in the Zero Pollution Action Plan, out of which I would like to specifically draw your attention to flagship 1 on reducing health inequalities through zero pollution. Under this flagship, we will further connect the zero pollution agenda with the Europe's Beating Cancer Action Plan and with the Atlas of Demography. Concretely, we will ensure that the announced Cancer Inequality Registry and the Atlas of Demography are regularly fed with data from our zero pollution monitoring and outlook reports, the first edition of which will be published together with the colleagues of the European Environment Agency and of the Joint Research Center in December 2022. This will help us better understand the links between pollution, health, and social inequalities. We will also ensure that the need for an inequality register identifying trends, disparities, and inequalities across the regions will be assessed for other pollution-related diseases as well, next to cancer. Because the point is that we want to really help local, regional authorities to target their intervention better and secure that also people are able to better compare how much pollution affects their health across the different regions where they live, study, and work. Let me move now to the following slide, where you can see how much environmental pollution is also a key factor for a successful One Health approach, as clearly human, animal, and environmental health are all intrinsically interconnected. The EU is working and will intensify its work with the so-called tripartite plus organization, the WHO, the FAO, the UNEP, to reach a renewed global and effective One Health consensus on environmental pollution. To get there, we are going to work towards revising our air quality legislation because it's crucial that we make sure that the 400,000 premature deaths due to air pollution alone become soon a thing of the past. We are therefore undertaking a comprehensive revision of these rules in order to better align the current EU standards on air quality with the latest recommendation of the WHO, which have been issued in September this year. We want to make transport quieter so that 16% of Europeans don't have their sleep heavily disturbed anymore. We want to bring more EU water bodies to sufficient quality levels for the environment, but also, of course, to save on the significant efforts we pay today in water treatment. We will identify and remediate the soil of many more contaminated sites and improve agricultural practice so that we use nutrients more efficiently. We need to grow good food without polluting water and air. At the moment, interconnected pollution aspects are dealt by many actors and bodies at national, European, and international level in a rather fragmented way. We want to fix this and provide a compass to mainstream pollution prevention in all relevant EU policies, with good repercussions also on international activities. Let me stress that the Zero Pollution Action Plan is a prime example of the Green Deal joint policy making. It goes hand in hand with the EU climate neutrality, health, biodiversity, and resource efficiency goals, and builds on initiatives in the field of energy, industry, mobility, food, and agriculture. So, as you will by now will have fully understood, really with the Zero Pollution Action Plan, we are aiming to connect our actions on pollution better and to strengthen them, with a view ultimately to make it easier for policymakers and business owners to understand where they can at best invest their respective political and financial capital to achieve multiple targets at the same time. This is why all sectors need to be involved. And this is precisely why we are now rolling out the Zero Pollution Stakeholder Platform, whose first high-level meeting will take place next December 16th, kicked off by the first Executive Vice President Timmermans and Commissioner Sinkevičius. The platform has the ambition to bring together stakeholders and experts on different policy areas to mainstream the zero pollution agenda, foster integrated solutions, and share good practices. So let me sum up by saying the Zero Pollution Action Plan is a key pillar of the Green Deal agenda. We will implement it as an integrator and a compass, joining forces across all relevant policy areas and providing a more compelling quantification in terms of costs and benefits for our economy and societies, not least in terms of health benefits for all. The fight against pollution is a fight not just for a healthier, but also for a fairer Europe and planet. And this is a fight we definitely cannot afford to lose. Thank you so much for your attention. And should you have any questions, feel free to post them in our ad hoc app. Thank you.